Well, thank you very much, Chairman Blunt. And Secretary Price, appreciate your being here today because there is a lot to talk about. From your administration's proposed budget for the Department of Human Services to the secret version of Trump Care that Senate Republicans are rushing to jam through in a matter of days. I am deeply concerned the work of your administration on health care would take our health care system and the well-being and financial security of families nationwide in a deeply damaging direction. So I want to start with Trump Care. There are reports that the all-male working group of Senate Republicans actually has a bill in draft form. Democrats haven't seen it. Patients and families are being locked out of the process. They haven't seen it. Governors and state legislators who need to know what is in this bill and what it means for their states are being kept in the dark. And it's clear Senate Republicans are doing everything they can to make sure it stays that way. And it's pretty clear why. Based on the reports we've heard, the Senate Trump Care plan would take the same harmful approach as the, now I quote President Trump, mean House bill. Under Trump Care, people's health care costs, especially for seniors and those with pre-existing conditions, would go way up. Millions of people would lose Medicaid coverage and could lose benefits they need if they live in a state that can't afford the changes or chooses to gut traditional Medicare. Patients nationwide, men and women, would lose access to providers that they trust at Planned Parenthood. We've seen the consequences in Iowa already, where a defund effort has caused 4 Planned Parenthood centers to close. All of this and more will happen. Why? So special interests in the healthcare insurance industry can get a massive tax break, and so that President Trump can get a hollow political win. Secretary Price, given President Trump's promises to provide coverage for everybody that is higher quality and lower cost, I'm very interested in hearing how you plan to defend these policies, especially since this budget doubles down on them and makes their impact even worse by gutting programs that support patients and families in most need. During the president's campaign, he promised not to cut Medicaid, and you repeated denial of this fact. Despite that, your budget would end the traditional Medicaid program as we know it by imposing draconian cuts to coverage for millions of children, pregnant women, people with disabilities, and low-income seniors. And while your budget proposes extending the Children's Health Insurance Program by 2 years, it includes draconian cuts to that program that would most certainly jeopardize health care for millions more children and families. It cuts vital medical research at the NIH by 21%, which I will focus on in greater detail at our hearing next week. It slashes public health programs at the CDC by 17% at a time when we are facing new and emerging diseases and continuing to combat threats such as Zika. It eliminates safety net programs like LIHEAP and the SSBG by more than $6 billion. And despite the still escalating crisis of opioid and heroin addiction, it cuts funding for prevention and treatment programs by $84 million. And it eliminates healthcare workforce programs that help states meet the increasing demand for substance abuse counselors. I also want to take a few minutes to specifically address a few of the ways this budget would impact women. Not only did you include a new and expanded poison pill rider to specifically exclude Planned Parenthood from federal funding under the budget, but you are secretly, as we know, crafting a sweeping revision of the Affordable Cares Act contraception coverage mandate to expand the number of employers that could deny women coverage for birth control. Coupled with your intent to slash Medicaid, which serves 1 in 5 women of reproductive age, your budget proposals would deny preventive and primary care benefits to millions of women nationwide. In short, Mr. Secretary, your administration's policies from Trump Care to this proposed budget double down on leaving women, seniors, families sicker and more vulnerable and less able to access and afford the care they need. So I am deeply concerned about the impact this administration's policies will have on our families and our communities' health. Now, I'm hopeful Senate Republicans will reject the devastating cuts that are presented in this proposed budget. And I hope that they will reconsider the impact of Trump Care, a bill the president himself again called mean on patients and families and choose to reverse course. And if they do, as I've said time and time again, if they are willing to stop undermining the healthcare system and work towards real solutions that help lower healthcare costs for families and help people get more quality care, we as Democrats are ready. We will be at the table. We want to take care of our healthcare system. We want to take it in the right direction to help patients and families, and it is not too late. So thank you very much, Mr. Chairman.